Hi, my name is Nicole Nelson, and today I'm going to be showing you how to do range of motion, manual muscle tests, and muscle length tests for the hip. So the first thing I'm going to do is I'm going to assist my patient into supine, and she's going to be hugging her legs. Okay. One thing I also want to check for is that her lumbar spine and her pelvis are both level with the table. Now what I'm going to have her do is let go of one of her legs. And this is what normal would look like for all of her muscles. If her leg was flexed like this, that would indicate shortness of the iliopsoas. If it was flexed and extended like this, her thigh would not be able to touch the table. This would indicate shortness of the rectus femoris. If her leg was slightly abducted, that would show tightness of the tensor fasciae lata. In this case, her thigh would be able to touch the table though. It would just be abducted instead of at neutral. And then for another muscle, the sartorius, if there was shortness in that muscle, you would see external rotation of the hip. Her leg would not be able to extend, it would be flexed, remain flexed. So right now the position I have the patient at is she's supine. She is towards the edge of the table because I'm going to be moving her leg outwards. So I'm going to use my goniometer. My axis is going to be on her ACES, the ipsilateral side, and then her stationary arm is going to be on the contralateral ACES, and I'm also going to have the moving arm at the midline of the thigh towards the patella. So I'm going to instruct my patient to go ahead and bring her leg outwards, and I'm also going to be stabilizing her pelvis while doing so. Go ahead and bring that out as far as you can. Okay, good. So then I'm going to move my moving arm. 45. Now one thing to note is also I started this at 90 degrees because this is how you're going to be starting it out when you start the measurement. For her, she came out to 47 degrees motion. So the position I have my patient at is she's sitting right now. There's a towel right under her thigh to help keep that level. I also have a stool over here on her opposite leg. That's to help keep the leg out of the way. And for stabilization, she's sitting up. Her sitting position is helping stabilize her hip. She does have her hands holding onto the edge of the table also to provide some balance and some support, and helps keep her sitting up straight. All right, so for measurement, my axis is going to be the midline of her patella. The stationary arm is going to be perpendicular to the ground. The moving arm is going to be in line with the shaft of the tibia. Okay, so what I'm going to have her do is move her leg out like this. Okay. And for her, I'm showing 44. So the position I have my patient at right now is she's sitting. She's going to completely flex her leg. She has her hands on the side of the table to give her a little extra balance and support, but for stabilization, that's pretty much due to her sitting position. That's already putting her in stabilization. So I'm going to help you out. I'm going to assist you. I'm putting you in a complete flexing movement. Okay, I'm going to let go. Can you keep that position? Okay. Okay, and now I'm going to press against the anterior part of her thigh into hip extension. All right, I'm going to press down. Don't let me. 1, 2, 3, 4, 5. Okay, for that I would give her a 5 with max resistance, keeping it up and not moving. That's a 5. So I have my patient in sideline position. I'm going to be stabilizing the lateral part of her hip, and I'm also going to assist her into abduction. She's going to be in slight extension because we're doing the glute med, and she's also going to be in slight external rotation. And I'm going to push her into a direction of adduction and slight flexion, and I'm going to push against the distal part of her lower leg. All right, don't let me push you down. 1, 2, 3, 4, 5. Okay, and I would give her a grade of a 5 because she did not manage to move with max resistance.